So the Twinings organisation have partnered with us. We've hosted their service, and it's been a fantastic success since it started. We've had some very good employment outcomes with limited investment. I think what we've seen, we've got about 29 outcomes so far from the process of offering this support, and I wouldn't want to pin one down, to be honest, because we're seeing people getting jobs in all sorts of industries, and it reflects the nature of the different types of needs people have around employment, and people are suited to different industries. I think what's great to see is people who've been out of employment for a long period of time are getting opportunities to go back into work. So I had one chap who was unemployed for 5 years, and he's now back working, earning his own money, being part of a scene with a different identity, which is formidably powerful for him. And not only that, those are the hard outcomes in terms of what the initiative is set to achieve: employment above 16 hours. On top of those outcomes, there's been a lot of transactions with other people who are being put onto pathways towards employment, and there's been about 220 other cases who have had the support of the Twinings approach and the IPS model of delivery, and they're also being put onto pathways to employment. So whilst they haven't achieved employment yet, they're in a different place in terms of thinking about employment and thinking about their position in society. So it's quite a transformative opportunity that's been provided. I think it's nice to have it recognised that partnership working achieves good things for our customers, for the service users in our community. But more fundamentally important, I think, is the destigmatisation message that goes along with it. What it says is that employment matters, and that people and services and society needs to recognise that employment is important for people with lived experience of mental health conditions, and that we can achieve positive outcomes in this area. So I think it's more validating for us as an organisation, for our own employees to face their own stigma and challenge their own expectations around actually this person that we're providing care services to reach a position of employment again. It challenges us to think about our own work as much as it does our broader community.